Hello everyone, my name is Ana Ruby Kalunsud. I am the officer in charge, unit head of pediatric wing and pediatric ICU at Brokenshire Medical Center. So for today's session, I am going to discuss about the practices that assist breastfeeding. So for this session, we do have objectives, which are number one, describe their role in practices that assist rooming in. Describe their role in practices that assist baby-led feeding or baby demand feeding. Suggest ways to awaken a sleepy baby and to settle a crying baby. Number 4, list the risk of unnecessary supplements. 5 would be describe why it is important to avoid the use of bottles and teats or the teethers. And lastly, discuss removing barriers to early breastfeeding. Practice rooming in. It allows mothers and infants to remain together 24 hours a day. So, what can you say to explain the importance of rooming in? Routine separation should be avoided. Separation can occur only if the mother and the infant need other medical treatment after the delivery. So, let's proceed with the importance and benefits of rooming in. Number one, babies sleep better and cries less if the baby is near to her mother. Number two, before birth, the mother and infant have already developed a sleep awake rhythm that would be disrupted if we separated both of them. Number three, breastfeeding is well established and continues longer if it is room in with the mother. And this will help the baby to gain weight quickly. Number 4, feeding in response to a baby's cues is easier when the baby is near the mother, so thus helping develop a good milk supply. So the more latching to the mother, the better. Number 5, mothers become confident in caring for the baby. Next, the baby is exposed to fewer infections when next to his mother rather than in a nursery. And the last, it promotes bonding between mother and baby even if the mother is not breastfeeding. So it's a simple but just by just rooming in, the baby will we already promoting bonding to the mother and the child. Barriers to rooming in and possible solutions. Number one barrier is concerns that mothers are tired. So wards routines needs to facilitate the mother's rest with quiet times during which there is no cleaning, no visitors, no medical rounds or procedures. In addition, review birth practices to determine if long labors, inappropriate anesthesia and episiotomies, lack of nourishment, and stressful conditions are resulting in mothers being extra tired and uncomfortable. The number 2, taking the baby to nursery for procedures. Baby care should generally take place at the mother's bedside or with the mother's present. This can provide reassurance and teaching opportunities for the mother as well as providing comfort for the baby if distressed. Number 3 barrier believes that newborn babies need to be observed. A baby can be observed next to the mother as easily as in a nursery. A mother is very good at observing her own baby and often notices changes before a busy nurse notices them. Close observation is not possible in a nursery with many babies. Number 4, barrier. No space in the ward for baby's cot or crib. Babies can share their mother's bed. Bed sharing or co-sleeping can help mother and baby get more rest and breastfeed frequently. The bed may need side rails, chair against the bed or against the wall to reduce risk of falling out of bed. Number 5, staff do not know how to assist mothers in learning to care for their babies. Soothing and caring for a baby is an important part of mothering. Helping a mother to learn to care for her baby at night is more useful to the mother and will build her confidence that she can cope with being a mother. Next, mother asked for their babies to be taken to the nursery. We explained to the mother that rooming in is in the time to get to know her baby, and explain also to the mother the other benefits of rooming in from the previous slide. If separation is required because of medical reason, document the reason for separation in baby's record. The need should be reviewed frequently so that it is for as short as possible. Step 8. Encourage breastfeeding on demand. The demand feeding or the baby-led feeding. This means that the frequency and length of feeding is determined by the baby's needs and signs. The importance of baby-led feeding or the demand feeding. Number 1, the baby gets more immune-rich colostrum. Number 2, faster development of milk supply. Number 3, faster weight gain of the baby. And less neonatal jaundice. Infants who are allowed to control the frequency and duration to a feed learn to recognize their own signs of hunger and satisfaction. This ability to self-regulate may be related to the lower rates of obesity in children who are breastfed. Next slide, the other importance of baby-led feeding. So number 6, less breast engorgement of the mother. 7, mothers learn to respond to her baby's needs. Number 8, breastfeeding established faster. Number 9, less crying and less temptation to supplement the baby. And the last, longer breastfeeding duration. So next slide. What are the signs to watch for in a newborn baby to indicate when to feed the baby? So there are signs of hunger. Number 1, the time to feed a baby is when the baby shows early signs of hunger. The baby increases eye movement, under closed eyelids or open eyes. Opens his or her mouth, stretches out the tongue, and turns the head to look for the breast. And makes soft whimper sounds, sucks or chews on hands, fingers, blanket or sheets, or other object that comes into the mouth contact. Next, if the baby is crying loudly, arcs his or her back, and has difficulty attaching to the breast, these are late hunger signs. So the baby then needs to be held and calmed before the baby is able to feed. Some babies are very calm and wait to be fed or go back to sleep if not noticed. This can result to underfeeding. Other babies wake quickly and become very annoyed if not fed immediately. So we help the mother to recognize her baby's temperament and learn how to best meet her baby's needs. What are the signs that a baby has finished feeding, or what indicates that the baby has finished feeding? There are signs of satiety of the baby. One is that at the start of a feed, most babies have a tense body. So as they get full, their body relaxes. Next, most babies let go of the breast when they have had enough, though some continue to take small gentle sucks until they are asleep. Explain to the mother that she should let her baby finish one breast before she offers the other breast in order to feed the rich hind milk and to increase the milk supply. Feeding pattern. Some babies feed for a short time at frequent intervals. Other babies feed for a long time and then wait for a few hours until the next feed. Babies may change their feeding pattern from day to day or during one day. Very long feeds, more than 40 minutes for most feeds. Very short feeds, less than 10 minutes for most feeds. Or very frequent feeds, more than 12 feeds in 24 hours on most days. This may indicate that the baby is not well attached to the breast. Sore nipple are the result of poor attachment, not the result of feeding too often or too long. If a baby is well attached to the breast, it does not matter if she or he feeds often or for a long time as some feeds. The typical feeding pattern for a full-term healthy newborn. So we teach mothers the typical feeding pattern for a full-term healthy newborn. Number one, newborn wants to breastfeed about every 1 to 3 hours in the first 2 to 7 days, but it may be more frequent after that days. Second, night feeds are more important to ensure adequate stimulation for milk production and milk transfer and for fertility suppression. Next, once lactation is established, the milk supply comes in. 8 to 12 breastfeeds in 24 hours is common. There are usually some longer intervals between some feeds. During period of rapid growth, a baby may be hungrier than usual and feed more often for a few days to increase milk production. And let babies feed whenever they want. This satisfies the baby's needs if hungry or thirsty and the mother's needs if her breasts are full. There are some special situations that we can encounter at this time. And there are number one, if a baby is very sleepy due to prematurity, if the baby is jaundice, or the effects of labor medication, or if the mother's breasts are overfull and uncomfortable. The mother may need to lead the feeding for a day or two and wake the baby for feeds. Babies who are on replacement feed also need to be fed in response to their needs rather than to a schedule. Sometimes there is a tendency to push the baby to finish a feed because the milk is already prepared. This can lead to overfeeding. A mother can watch her baby for signs of fullness. The one is turning away or reluctance to feed. A replacement feed should be used within 1 hour of the baby starting the feed and not kept for later as bacteria will grow in the milk. Next, ways to wake a sleepy baby. So if the baby seems too sleepy to feed, we suggest that the mother should remove blankets or any heavy clothing and let her baby's arms and legs move. Breastfeed with her baby in a more upright position. Gently massage her baby's body and talk to her baby. Wait half an hour and try again. Avoid hurting the baby by flicking or tapping on the cheek or feet. Settle a crying baby. A mother and her family may think that a crying baby means that the mother does not have enough milk or that her milk is not good milk. A crying baby can be a difficult for a mother, and it can reduce her confidence to herself and her family's confidence in her. A baby who is crying too much may really be crying more than other babies, or the family may be less tolerant of crying or less skilled at comforting at the baby. It is not possible to say how much crying is normal. If a baby is crying frequently, look for a cause, listen to the mother, and learn what her situation may be. Observe a breastfeed. Examine the baby and refer for further medical attention if needed. Babies may cry from hunger, pain, loneliness, tiredness, or other reasons. So we build the mother's confidence in her ability to take care of her baby and give her support. Build the mother's confidence in her ability to take care of her baby and give her support. We listen and accept what the mother is feeling, reinforce what the mother and baby are doing right and what is normal, give relevant information to the mother, make one or two suggestions, and give her practical help. Suggestions and practical help to settle a crying baby can include: make the baby comfortable, like drying the baby, clean nappy, warm, dry beddings, but not too warm. Put the baby to the breast. The baby may be hungry or thirsty or sometimes just wants to suck because this makes the baby feel secure. Put the baby on the mother's chest, skin to skin. The warm smell and heartbeat will help to soothe the baby. Talk, singing, and rock the baby while holding close. Gently stroke or massage the baby's arms, legs, and the back. Give one breast at each feed. Give the other breast at the next feed. If the breast not used as the feed becomes overfull, express a small amount of milk. Reduce the mother's coffee and other caffeine drinks or intake. Do not smoke around the baby and smoke after a feed, not before or during if a smoker. Have someone else carry and care for the baby for a while. Involve other family members in the discussion so the mother does not feel pressure to give unnecessary supplemental feedings. Like the mother will decide that she will bottle feed the baby. Hold the baby in a manner that wraps around and supports head, body, legs, and arms so the baby feels secure. The next slide would be: give newborn infants no food or drink other than breast milk unless medically indicated. Healthy full-term babies rarely have a medical needs for supplements or pre-lactal feeds. They do not require water to prevent dehydration. The needs of babies who are premature or ill and medical indications for supplements are discussed in a later session. Next, the dangers of supplements. Exclusive breastfeeding is recommended for the first 6 months. If we give supplements, the baby can overfill the baby's stomach, so the baby does not suckle at the breast. It reduces the milk supply of the mother because the baby is not suckling, resulting in overfullness of the breast of the mother. It causes the baby to gain insufficient weight. If feeds of water, these are glucose, water are given instead of milk feeds. It reduces the protective effect of breastfeeding, thus increasing the risk of diarrhea and other illnesses to the baby. We expose the baby to the possible allergens and intolerance that could lead to eczema and asthma to the baby. It reduces the mother's confidence if a supplement is used as a means of settling a crying baby. It would be a necessary and potentially damaging expense. In addition to the points listed above that could be explained to the mother, or more reasons why supplements use is not recommended. One is a mother who is looking for a supplement may be indicating that she is having difficulties feeding and caring for her baby. It is better to help the mother to overcome the difficulties than to give a supplement and ignore the difficulties. A health worker who offers a supplement as the solution to difficulties may be indicating a lack of knowledge and skill in supporting breastfeeding. Frequent use of supplements may indicate an overall stressful atmosphere where a quick temporary solution is chosen in preference to solving the problem. The next slide would be the topic about prelactal feeding or offering formula to an infant of an HIV positive woman who will breastfeed may alter the GI mucosa and allow the transmission of the virus. When we cannot test the HIV status of the mother, it is important to emphasize that exclusive breastfeeding reduces the risk of HIV transmission during breastfeeding. Next, if a mother has been counseled, tested, and found to be HIV positive and has decided not to breastfeed her baby, this is an acceptable medical reason for giving her infant other milks in place of breast milk. Even if many mothers are giving replacement feeds, this not prevent a hospital from being designated as baby-friendly hospital if those mothers have all been counseled, tested, and made genuine informed choices. The next step, the step 9 of the 10 steps to successful breastfeeding states. Give no artificial teats or pacifiers, also called dummies or suitors, to breastfeeding infants. Why is it recommended to avoid using bottles or teethers? Sometimes babies develop a preference for an artificial teat or pacifier and refuse to suckle at the mother's breast. If a hungry baby is given a pacifier instead of a feed, the baby takes less milk and grows less well. Teats or teeter bottles and pacifier can carry infection and are not needed, even for the non-breastfeeding infant. Ear infection and dental problems are more common with artificial teeth or pacifier use and may be related to abnormal oral muscle function. In the rare situation that a supplement is needed, feeding with an open cup is recommended, as a cup is easier to clean and also ensures that the baby is held and looked at while feeding. So, in summary, number 1, rooming in and baby-led feeding help breastfeeding and bonding. Mothers can notice and respond to their babies with ease when they understand their baby's feeding cues. Babies cry less, so there is less temptation to give artificial feeds to the babies. Mothers are also more confident about caring for their babies and breastfeeding. If breastfeeding is established early, a baby's gain weight well, and breastfeeding is more likely to continue for a longer period of time. Number 2, help mothers to learn skills of mothering. It helps the mother to learn how to wake a sleepy baby. It helps to learn how to settle a crying baby. And it helps the mother to learn how to look for hunger cues of the baby. Number 3, prelactal and supplemental feeds are dangerous. They can increase the risk of infection to the baby, intolerance, and allergies. It also interfere with suckling and make breastfeeding more difficult to establish. And the next, artificial teeth can cause problems. The use of pacifier or nipple shield may affect the milk production of the mother. That's all. Thank you.